What is the age for gender-affirming care? What is the age for gender-affirming care? This is a question many people have when considering the support available for transgender and non-binary individuals. Let's break it down in a way that's easy to understand. Gender-affirming care includes a variety of services that help align a person's physical traits and social presentation with their gender identity. The age at which different types of care are available can vary based on the type of care, legal rules, and medical guidelines. First, social gender-affirming care is accessible at any age. This includes adopting a new name, using preferred pronouns, and changing clothing or hairstyles. Since these changes are reversible and do not involve medical procedures, anyone can start this process whenever they feel ready. This type of support is important for expressing gender identity and can help improve body image. Now, when it comes to medical gender-affirming care, things get a bit more specific. Medical interventions usually begin around the onset of puberty. Puberty blockers are medications that can delay the physical changes that occur during puberty. These are generally considered for youth starting around ages 10 to 14, depending on individual circumstances. Using puberty blockers can help prevent the development of secondary sex characteristics that may increase feelings of gender dysphoria and body image distress. Hormone replacement therapy is another medical option. This treatment typically starts no earlier than age 14. Hormone therapy can lead to irreversible changes, so it is essential to assess the adolescent's mental health and the persistence of their gender dysphoria before proceeding. Surgical options are generally for adults aged 18 and older. However, in some rare cases, surgeries like breast removal or augmentation may be performed on minors aged 16 or 17, but only with parental consent and thorough medical evaluation. Genital surgeries are almost always limited to adults due to their permanent nature. Access to gender-affirming care is vital for mental health, especially for transgender and non-binary youth. Many of these young people experience significant distress related to body image, which can lead to eating disorders. By providing appropriate gender-affirming care, including social affirmation and medical interventions, mental health outcomes can improve and body dissatisfaction can decrease. It is important to note that legal restrictions can vary by location. Some states have laws that limit access to gender-affirming medical treatments for minors, which can affect the availability of puberty blockers, hormones, and surgeries. These laws often requiring parental consent and a thorough evaluation by a team of professionals. In summary, gender-affirming care begins with social affirmation at any age. Medical interventions like puberty blockers and hormones typically start in early to mid-adolescence, while surgeries are mostly reserved for adults, with some exceptions for older minors. This approach helps address body image concerns and supports mental health for transgender and non-binary youth.